Health Agency of Canada tells us that 1 in 66 children are living with autism spectrum disorder, or ASD. But I'm sure the prevalence is higher because 2 of my 3 children have been diagnosed with ASD. Jordan was diagnosed when he was 2.5 years old, and we started behavioral intervention shortly before he was 3. Dominic was born a few years later, and his development was pretty typical, and we breathed a sigh of relief thinking that he was ASD-free. In grade 5, his teacher recommended that he be assessed, and sure enough, he was diagnosed with ASD at age 11. I was disheartened because I knew that extensive research has shown that starting treatment before age 3 has better outcomes for the child and family as compared to starting at a later age. I felt I had failed my son, and I berated myself for not acting earlier. This is the story that led me to ask my PICO question for this term. Would routine screening for autism spectrum disorder in toddlers at age 18 to 24 months lead to early intervention, thereby promoting positive behavioral and social outcomes as compared to children who are diagnosed after kindergarten? I propose to conduct screening at public health units for all toddlers. Research has shown that the modified checklist for autism in toddlers, or the MCHAT, is a valid screening tool when it's used as part of a 2-step screening process. The screening appointment would involve parents completing the MCHAT and then meeting with a provider, such as a nurse practitioner, who would take a detailed developmental history and ask about any parental concerns. The NP could make appropriate referrals for follow-up assessments or tests as needed. The public health unit would be an appropriate choice for this, as many British Columbians do not have access to a family doctor. In Illinois, a similar intervention was put into practice in which the Plan, Do, Study, Act cycle was employed. This is a cyclical 4-step process that allows for a change in practice to be tested on a small scale and correct any problems before rolling out to the whole organization. It is a cycle and should be repeated over and over until all the kinks have been ironed out. This model could be feasible in Vancouver, where we have 17 public health units. I propose a screening clinic be implemented at one unit, have all the problems ironed out before rolling it out to all the other units. The Illinois project also stressed the importance of a team-based approach in which there's a clear leader who can be a champion for the project, as well as act as a resource for the team, an advocate for families, and as a liaison with external resources. You can see why this topic is so near and dear to me. If this screening had been routine as are immunizations, I would have known about Dominic's diagnosis, and we could have started treatment earlier. It is my hope that with this intervention, more children are identified earlier, and the effects of ASD on the family and society as a whole would be mitigated. Thank you.